Sport is an important aspect of people's lives in Australia, especially Australian rules football. The game is a big part of our cultural heritage and plays a significant role in the nation's economy and recreational activities. AFL is a fast and physical game where players run hard, leap to take high marks, and change direction rapidly to apply or avoid tackles. The demands of the game put enormous strains on players' bodies, especially the lower limbs. This often results in injuries to players' ankles and knees. Statistics show that AFL has the highest incidence of injuries of any sport in Australia, followed by basketball and netball. A study of AFL players found that 16% of all reported injuries are to the knee. These injuries alone account for almost 20% of total missed playing time. During 2004 alone, 5.2 million injuries were reported across all levels of sport in Australia. The estimated cost to the community was $1.8 billion. In 2006, an Australian Institute of Health and Welfare study found that children under 14 made up the greatest proportion of hospital admissions for sporting injuries, with more than 14,000 treated every year. Scientists at the University of Western Australia are conducting research on sporting injuries and how they may be minimised. Before we look at this research, Dr. Peter D'Alessandro, orthopaedic registrar and PhD student at the university, will give us some background information about the anatomy of the knee and describe some of the injuries that can occur.
The knee joint is one of the most complex structures in the body, in a large part due to the number of structures required to allow it to function normally, as well as the huge loads and forces that it's required to withstand. There are four major ligaments within the knee: the lateral collateral ligament, or LCL, the medial collateral ligament, or MCL, and internally the anterior cruciate ligament, or ACL, which sits at the front, and the posterior cruciate ligament, or PCL, sitting at the back. The two cruciate ligaments, known as cruciate because they are crossed in the internal part of the knee, prevent forwards and backwards movement of the tibia on the femur. Although the knee is designed to withstand very large forces, there are certain situations where either excessive forces or forces acting in certain directions can cause significant damage to the knee joint. A special case of damage is when the ACL is ruptured. An ACL rupture can occur when certain forces are enacted onto the knee. ACL rupture is a common and important injury in AFL players. There are a number of situations where ACL rupture can occur. Interestingly, the vast majority of these injuries happen in non-contact situations. The common situations are when a player is decelerating or slowing down, where a player is suddenly trying to change direction, or when a player is landing after jumping. An ACL injury can have a devastating impact on a person's life. For a start, after the injury, the knee is quite unstable, and in the majority of cases, especially in a young person, ACL reconstruction surgery is required.
Research Assistant Professor Tim Doyle from the School of Sports Science, Exercise and Health is a biomechanist researching the forces on AFL players' knees. He's designing techniques and exercises to reduce the incidence of knee injuries, particularly to the anterior cruciate ligament. In AFL, sidestepping and the ability to make rapid changes in direction are important aspects of the game as players apply or evade a tackle. However, sidestepping is a manoeuvre that carries with it a higher risk of injury to the knee. Because of this, Tim has been studying the forces on players' knees during sidestepping moves.
The main pieces of equipment that we use are a force plate and the Vicon 3D motion analysis system. The force plate records the forces as the people run and sidestep over the top, while the Vicon 3D motion analysis system records the movements to allow us to look at the knee angles as a person sidesteps and runs, and also the forces and the moments through the knee as they sidestep and run. Another piece of equipment that we use is a Force 3 Non Motorized Treadmill. This is different from the in-ground force plate, which only measures 1 foot stroke, while the treadmill allows us to look at forces, both vertical and horizontal, of a person running over an extended period of time. We are also able to record the distance that they run, and from this derive the velocities and accelerations. To collect the data for our research, we get the players to run over the force plate. They run over the force plate performing a sidestep, which will be pre-planned or unplanned. In addition to these sidesteps, we get the players to do a straight line run through over the force plate. We use this straight line run through to collect our baseline data and compare our other sidestep trials to this baseline data. One of the trials that we collect in the lab is a planned sidestep. In a planned sidestep, the player knows ahead of time which way they are sidestepping, either left or right, off their dominant leg. The player will run towards a force plate, and as they hit the force plate, they will sidestep off their dominant leg in their known direction. The final type of trial that we collect in the lab with the players is an unplanned sidestep. In an unplanned sidestep, the player runs towards a force plate, and when they are 2.5 metres behind the force plate, the computer monitor indicates which direction they are to sidestep, either left or right. As the player hits the force plate, they sidestep left or right in this direction. What we know about these 3 types of trials is that a straight line run through has the lowest forces going through the knee, and therefore the lowest risk of injury to the player. The planned sidestep has higher forces going through the knee than the straight line run through, whereas the unplanned sidestep has the highest forces of the 3 trials, and therefore has the highest risk of injury to the player.
Through his study of the forces on players' knees, Dr. Doyle has developed new techniques for sidestepping, as well as a series of balance and posture exercises. These can be incorporated into training schedules and hopefully reduce the incidence of future knee injuries. Rupture of the anterior cruciate ligament is possibly the most feared injury amongst all athletes. While a surgeon can repair an injured knee, an ACL reconstruction will normally keep a player out of his or her sport for 5 to 12 months. There's also a lifelong risk of further problems, both to the injured and uninjured knee. It's our hope that the research conducted at UWA and the new techniques and exercises will not only reduce knee and ACL injuries amongst AFL and netball players, but will benefit the whole community.